Hello, everybody, and welcome to our Facebook Live today. I'm Lori Jo Vest, and I am here with Dr. Woodbeck from Mile High Denture and Implant Centers. Hi, Dr. Woodbeck.
Hi, how are you today?
Very good. We are here to talk about dentures versus implants. What's the difference and what's right for you? So, let's talk about the basic differences between dentures and implants. I know a lot of people know what dentures are, but let's talk about dentures. How long do they last? That kind of thing.
Yeah, so you can get a denture, and it's like made of a plastic type of material, and the teeth are kind of a plasticky material. They fit in your mouth, they go in and out, and you take them out at night to clean and everything. And generally, we encourage people to try and sleep without them. But they last maybe 5 to 10 years or so because you'll have facial changes over time as you age, or if you gain weight or lose weight, those things. And sometimes the denture needs to be adjusted in that time, or a new denture will need to be made as well too. And plus, people end up wearing down the teeth on their denture, so
Oh,
they can need to be remade for that reason as well too. So number of reasons that dentures need to be maintained. It's not just you get one and you're done for life. You buy a new pair of shoes every so often as well too. A denture is kind of in the similar vein there.
right. Now, if you go with let's say the all-on four dental implants, those are permanent, right?
Yeah, so the dental implants, like the all-on-four procedure that you can read about quite a bit, is that you have multiple implants that are placed in the jawbone, and then the teeth are connected, basically
Oh,
screwed onto the implants, and then they stay in all the time. They don't go in and out. We here can, we have a little screwdriver, and we can remove the teeth actually from the implants and be able to clean under there if we need to, or address certain things. But they're staying in, and the implants themselves that are in the bone, they'll last as long as you take care of them. So,
yeah.
there's still some maintenance that needs to be done. As long as you're, cleaning around them and everything, then we should be able to maintain those for an extremely long life.
That's awesome. But they do require some maintenance. So is that usually coming in like once every 6 months, once a year?
But
What
once a
does that look like?
year is kind of good
Okay.
so that, we can just make sure that there's some cleaning around the implants, kind of like cleaning around a tooth with a hygienist, and then some x-rays periodically just to make sure that everything looks okay. And we try and address problems if they do occur early so that we're not having bigger problems down the road.
Got it. Now, I know one of the issues that people sometimes have with dentures is getting the right fit, right? That can be a struggle. Tell us about that.
Yeah, so the denture, like an upper denture, like the one that I'm holding here, kind of covers the roof of the mouth, and it kind of suctions in a little bit. But a lower denture is kind of like a little bit of a horseshoe sort of shape, and
Oh,
it doesn't really suction in, so it can kind of move around a little bit as people are eating and such. The upper denture, usually because it suctions into the roof of the mouth, usually can stay put, but it does still have some movement. So that's usually one of the big complaints that people have, is that their teeth kind of move, and
mm,
they find it a little bit harder eating things like steak or corn on the cob, or those things that require you to really chomp down on. So that can be
got
the
it.
struggle with dentures.
Yeah, and there's really not much you can do about that, right? With that lower denture only having a limited amount of real estate to sit on, I suppose it would be harder to make it stable. So
Yeah.
compare that to implants. Now, how are implants different?
Yeah. So the implants, they are into the jawbone, so they're into the bone, and the teeth are placed on those implants. So they are extremely stable. They shouldn't move at all. It should just all be connected, and should be able to bite into kind of anything with that. And there's none of this movement and trying to kind of manage that. Like sometimes with dentures, people are using glue and things to try and hold them in. With the
Mm,
dental implants and the teeth that are attached to there, there's none of that kind of worry.
so it's a more secure and comfortable fit. It's not going to move. One of the things that we hear from patients who've recently got their implants is they can't wait to go out and eat a good steak dinner. We always hear that.
It's very true. Yeah, people always have their one thing that they're really excited about, and
Yep.
whether it's a steak or some people it's an apple, some people it's a corn on
Yeah.
the cob, something like that, where they're just like, I've been avoiding it or I'm cutting up in certain ways. I want to be able to dive in.
Yeah, that makes a lot of sense. Now the other thing that we already talked about the fact that dentures are taken out at night, implants stay in. Um, Tell me about bone loss because often we get questions about, I have a lot of bone loss. Will I be able to get dental implants? Do dentures cause bone loss or are they just a symptom of not having? Is that just a symptom of not having ongoing pressure from teeth? Or why does that happen with dentures?
Yeah, so generally the bone in your jaw is there to support the teeth, and the teeth are there to kind of keep the bone around. So once you take out the teeth, then you get some resorption of the bone because they kind of have this nice little relationship together.
Mm.
So once the teeth are removed and a denture is placed, there's no stimulation on the bone, so it starts to resorb over time a little bit.
Ah,
With Yeah, the difference with the dental implants is that where those are placed into the bone, and then the teeth that are on there are providing some stimulation for the bone, so it kind of helps to keep around that bone as well too. So the bone has to have a reason to be there. It has to be
got
supporting
it.
something really. Yeah,
And it's gotta have some kind of a pressure against it. Sounds like when you have an osteoporosis diagnosis and they tell you to weight train and put pressure on that bone so it will strengthen. So that makes a
yeah,
whole lot of sense. I know some people may be intimidated by the fact that they're implanted into the jaw. But another thing we hear from all the people that we talk to online is that the implant surgery turns out to be relatively comfortable, surprisingly easy to heal from. This is what we hear from people constantly. So even though it might be more of a process to get them, do you think most people are happier with implants than they are with dentures?
yeah, 100%. People
Yeah.
are always much more excited about having the implants, especially, and you see the big contrast when somebody goes from a denture to an implant. Prosthesis with the teeth on the implants, of how much of a difference it makes to them as well. We
Oh,
try to, not have people end up in a denture if they're going for the implants where they have the teeth removed, the implants placed, and get teeth attached to theirs the same day, so that you're not having to go through that transition.
got it. That makes a lot of sense. Now, let's talk about the elephant in the room. One thing that
Mm,
that is true is that full arch dental implants are a higher investment than what you're going to have to pay for dentures, right? But
yeah.
there are compelling reasons for that. I mean, it's a surgery, right? Tell us
Yeah.
more about what's involved with the implants.
Yeah, so the implants, number one is, high quality implants cost money as well too from manufacturers. There's, some knockoff companies that, are out there, but for us, we always use high quality parts and pieces. So there's an expense in that. Plus the surgery, what we do is we make sure everybody is fully asleep while we do the surgery. So
Mhm.
everybody's comfortable. And it's a couple hour kind of surgery in order to get teeth out, get implants in, and go from there. So there's quite a bit involved there um, at the time of surgery. Plus, there's a lot of different kind of fitting appointments to make sure that the teeth that are on the implants are match the person, and the patient is happy with the outcome as well too. So there's a bunch of steps that kind of go on kind of in the background that really are adding to the investment as well too.
Got it. I also personally know that one of the things that is an absolute requirement to be able to, as a doctor and a medical professional, there's an extensive training that goes into learning how to place those full arch dental implants, isn't there?
Yeah, and somebody like myself, like I have a college degree and then a degree in dentistry that's 4 years. Plus, I have a oral and maxillofacial surgery residency and a medical degree. So I have both a dental degree, a medical degree, and an oral and maxillofacial surgery residency. So
Yeah.
quite a bit of training to be able to kind of take care of these types of procedures.
Yeah, it's a surgery. It's totally different than dentures. But there are so many ways that people can pay for that full arch implant process and to get their new smile. And I know the practice, just to let everybody know, the practice does accept a lot of the PPO insurances. as well as they have financial partners that you can work with to, make sure that you're able to fund that out over maybe, several years to be able to afford it. And once they're there, like Dr. Woodbeck says, they're permanent. And that's huge. So let's talk a little bit about the difference in the patients. When would you recommend, or would you ever recommend, that someone get dentures over implants?
For most people, we try and recommend more of the implants, depending
Mhm,
on kind of what people have going on in their lives. But generally, if people can get the financing in place, they're motivated for that, and they're motivated to take care of the implants afterwards. I would
mhm,
say that we generally recommend more the implant side of things. The dentures more so if people have a hard time kind of cleaning around things due to medical conditions and such,
mhm.
or sometimes the financing does become a little bit of a barrier there. But the doctors that I work with are extremely skilled in making dentures as well too, so they can make something that's fairly comfortable, and then maybe you want to upgrade to some dental implants down the road as well.
Yeah, that I've seen that happen. We've seen people on social media that say, "I had dentures for, 3 years and I've got my implants, and what a difference night and day in what they can eat and their confidence." I suppose there's something with not having to take them out at night that would add to you feeling more youthful maybe. So that's what we have for everybody today. Dr. Woodbeck, anything else you'd like to add?
No, it's if people are considering whether a denture or implants are right for them, it's always worth just getting an opinion or even multiple opinions and kind of go from there and see what your options are. Because until you kind of walk through the door, sometimes there's certain things that you may not know.
Yeah, you may be an exceptional case, and it may be something that can get you in quickly and be on to, a new life with a new smile relatively quickly. So we're running the website address on the screen right now. If you would like to know more and consider a free consultation, we do offer free consultations. And what that means is you come in and they meet with you, right, Dr. Woodbecker, with a doctor as well as a patient care coordinator?
Yeah, we always have a doctor that meets with all patients that come in for consultations to make sure that, we're looking at the images and getting the right treatment for each individual patient.
Love that. Yeah, so if you are interested, go to milehighdentalcenters.com. There's a form there you can fill out, and there's also a phone number you can call so you can get attention right away. And come on in for that free consultation, and let us tell you what you need and how we can help, and then also help you look at how to fund it. All of that first appointment is free. There's no obligation. Of course, we'd love to see you move forward with implants because we know how happy that they make patients. And the other thing is we have a Facebook group, and I'm going to run that right now. It's on Facebook. We are Mile High Denture and Implant Centers dash Colorado. And at the top of the Facebook page, follow us there. But at the top of the page, we also have a post pinned that has a link to our Facebook group. And you can go there and actually, if you're considering dental implants, go there and communicate with Mile High happy patients who have had the work done and are really excited about it and happy to answer any questions and share their experiences with you. So that's all we have for you today. We'd love to hear from you on social media. If you'd like us to cover a topic, we're going to be doing these Facebook Live events regularly. Thank you, Dr. Woodbeck, for joining us. I know your schedule is crazy, and I keep coming back and asking you to do it again. So I really appreciate you being here with us. And we will see you soon, sometime in June. Thanks so much for joining us.